In this video, we will talk about drugs in the mnemonic direction. A patient has come to you with chest pain. Ask yourselves, what drugs will cause chest pain? You're thinking about medications like these cause and cause chest pain in patients. If a patient comes to you with shortness of breath, think about what drugs will cause shortness of breath in this patient. If a patient has anaphylaxis, that can present as shortness of breath. If a patient comes to you with blood in urine, ask yourself, what drugs will cause blood in urine in this patient? For example, you're looking at warfarin, pixavan, or rivaroxaban. So these are all the things you need to look for. If you would like to know more about how to use the direction, save time, and get a lot of differentials in your clinical exam and in your real life as a practitioner, and be a safe doctor and a good clinician, make sure you look for a link under this video or link in the bio, and I'm going to teach you the OSCE mastery system and the 5 pillars to pass the clinical exams. So make sure you look for the link, and I will see you about how I can help you with passing your clinical exams and be a good clinician.